CHE Behavioral Health Services is a multi-specialty clinical group dedicated to increasing access to behavioral and mental health services and to reducing stigma associated with mental health conditions. We provide both psychology and psychiatry through telehealth and on-site in various settings, including clinics and healthcare centers.
CHE is not a new provider in mental health space. We have a strong history of providing services to patients since 1995. We have been increasing our coverage footprint considerably since 2015 due to an ever-growing demand for the fully integrated care model which we offer to healthcare partners. Today, CHE offers an expanded behavioral health and mental health services virtually via telemedicine to anyone who requires care and is over 18. At our core, CHE is a large clinical medical group. What truly makes our practice unique is our clinical foundation around patient care. We are not a tech company. What we do best is direct clinical care with our 100% employed providers. Our clinicians are not contracted or a vast temporary 1099 network with minimal cultural engagement. We believe this is critically important to consistently deliver on our mission of providing quality and timely access to care. Historically, we have always operated on-site and face-to-face with our clients. In this regard, we have unmatched services and training for our healthcare centers. But with the COVID-19 pandemic impacting in-person care, we felt maintaining access to care was a priority. Therefore, we expanded to providing virtual or telehealth services. We are proud to say we not only quickly made this shift to ensure the continuity of client care at our partnered healthcare facilities, but we also launched our outpatient services to adults age 18 and over in the community at large. In fact, CHE was able to transition 60% of care to virtual technologies almost overnight.
This was an important expansion of behavioral health services at CHE, which not only supports our mission to increase access to mental health care in general, but supported the increased demand for mental health treatment as a result of the COVID-19 pandemic. The pandemic has exacerbated nearly every behavioral health challenge: death of loved ones, job losses, severe isolation, and other pandemic-related stressors inflicted increased stress and really trauma on millions of individuals and families. Most people experience some form of anxiety, fear, loneliness, or down mood at some point in the past 18 months. Substance use transitioned from a social to a solitary activity and increased among adolescents and adults. Domestic violence worsened, and we can expect grief-related mental health issues for years to come. The rise of mental health issues has even led experts to dub the COVID-19 pandemic as a mental health pandemic. Unfortunately, for various reasons, not everyone who can benefit from mental health services is receiving that extra care and support. 1 in 5 adults reporting anxiety or depression symptoms said they needed but did not receive counseling or therapy. Among the 6.5 million adults with severe distress during the pandemic, less than half had seen a mental health professional in the previous 12 months. This is where CHE can come in to help. We collaborate with employer groups, local leaders, government agencies, and other community organizations to fill the gaps in the behavioral health care landscape by providing easy access to competent and compassionate care providers who are trained in evidence-based treatment for various mental health concerns.
After months of craving a return to normal, it is clear that there will be no rewinding the clock to a pre-pandemic reality. The behavioral health tsunami is our next pandemic, and CHE is prepared for it. CHE leverages technology and data science to deliver valuable care to thousands of individuals every day across multiple states. We are a rare behavioral health provider group that has 100% enrollment with both federal and state payer programs such as the Centers for Medicare and Medicaid, along with hundreds of commercial health insurance plans in all states we serve. For ones that are uninsured, our out-of-pocket rates are lower than a private provider. Another unique aspect of our group is that we are one of the fewest telehealth providers that offer a live, full-time customer service team to answer any questions that may come up. Our telehealth patients not only get matched to the highest caliber of psychologists and licensed clinical social workers, but they can also receive medication prescription and management services through our psychiatric nurse practitioners and psychiatrists.
At CHE, we really believe in the human element, and it's important for us to provide a live therapist to our clients from the very beginning. We do not engage with chat box or text messages, but we do provide free screenings and mood check options for clients who want to learn more about our offerings and to help us match them appropriately with a provider. We are continuously striving to provide the best care possible through quality assurance and education of our clinical providers. Our customer satisfaction scores remain above a 4.8 out of 5, and our clients keep coming back and are referring their friends and family.
Our dream is that one day everyone will check in with their therapist just as they do with their dentist or primary care physician. We believe that good mental health equates to good physical health, and early intervention and prevention is key to a lifelong of healthy coping with all the stressors and transitions we go through from a young age.
We are extremely passionate about what we do every day, and our providers are truly amazing. They are the real heroes. Throughout the past few decades, CHE has mastered the art of providing quality behavioral health care in an age of severe provider shortages, economic crisis, political turmoil, natural disasters, and community trauma. Today, by leveraging cutting-edge technology, we work tirelessly to develop our strong and dedicated team of clinicians to help their own clients weather any challenges they may face in the days, months, and years ahead.
You can get matched to a CHE provider by going to cheservices.com or calling 888-515-3834.